I'm Dr. Mike Milligan. I'm here with Milos Markovic of Snap-on Smile. Milos, thanks for joining us.
Thank you for having me here.
Great. Now, Snap-on Smile, I always thought that was kind of a low-end, hocus-pocus type thing that I just didn't believe that was good quality dentistry. But I found out that there are some excellent uses for it, and some of our mastermind group told me I had to get over here. By the way, we're at the Chicago Midwinter meeting, so there's some background noise. Sorry about that. But I just wanted to introduce you to this because I figure a lot of dentists out there had the same misconceptions that I do. So Milos, why don't you tell us, what is a Snap-on Smile?
Well, Snap-on Smile is a multi-purpose restorative appliance.
Okay.
It's made of a crystallized acetyl resin, which gives us the ability to bring the thickness of the material down to 0.5 millimeters without compromising its strength. It's a very flexible material. Any composite or resin will simply fracture with this kind of thickness where the patient would not be able to function with it. With our appliance, you're able to speak with it with no problem, you're able to eat with it, and it does not stain because it's a non-porous resin. Starts with a simple visit. The doctor will take upper and lower polyvinyl polyether impression with the bite registration.
Okay.
He would send it to us with a completed RX form, and then we would start with the wax up. It's a very, very big plus on a clinical side as far as Snap-on Smile goes, that we actually customize the wax up for every single patient.
Right.
So we mount those models, we start with the wax up, and there is a very famous concept that we have around our dental lab, which is holes or no holes.
Okay.
What does that mean?
Holes
means
or no
that
holes? This isn't golf we're talking about.
Yeah.
Right? Okay, what is it?
It is it's a concept of whether we want to change the patient's vertical dimension or not.
Okay.
If we do not want to change the patient's vertical dimension, we would open occlusal holes, in which way we would maintain the cusp to fossa relationship as is, and still cosmetically satisfy the patient. Whereas if we do want to increase the patient's vertical or change it to our own specification, we can do a full occlusal coverage. Now, in that particular case, if you're a dentist who specializes in TMJ treatment problems or condylar disorders, you could go into details, get with us on the phone, and we can go cusp by cusp, millimeter by millimeter to customize that vertical dimension that we want to achieve.
Okay.
So they can just snap it into place. Now let's talk about retention for a second. How does Snap-on Smile get its retention? Like we said, there's no prepping involved. All you need is impression from you. Every single tooth has a height of contour, naturally, of course, coming from the gingival area, coming onto a point. So we use that height of contour to get retention for Snap-on Smile. Now, a typical
really good retention, by the way.
A typical reciprocating infront bulge clasp, like in this flipper case, would engage probably 1.5 undercut on this particular tooth.
Right.
What if we can quadruple that retention and engage mesial, distal, lingual, and facial undercut at the same time, and provide 4 times the retention per tooth? That's why in implant temporary restoration, when a flipper would have this palatal coverage, this metal clasp showing, we bypass all that, no palatal coverage, so the speech of the patient is not going to change.
Speech doesn't change, so they don't have all of the palatal acrylic on.
Exactly.
If you're doing a flipper, or another use would be if you're doing implants, temporization for implants.
Exactly.
Those would be a couple of primary uses for this.
Primary uses for this, exactly, because
partial denture, flipper.
Depending on how long you're waiting for your implants to heal. I mean, some doctors like to wait 4 months, some doctors like to wait 6 months. It depends. So you want to have that patient comfortable, and aesthetically, you can give them a very close representation of what they're going to look like.
It looks nice.
And we open those holes, so we maintain its vertical, and we wax up the case. You get perfect aesthetics, and we can match any shade guide on the shade table you have.
And very, very comfortable. So, so what about the cost of something like this? You know, we've got the flippers that we do, the other types of temporaries, that type of thing.
Well, the price for the full arch would be $460.
If you're doing a full arch, $460.
Full arch, either upper or lower, $460. For a quadrant, which is 6 units or less, it would be $250.
Okay, lab
and you
costs
could,
$250.
Lab costs $250. What doctors usually like to do, they like to triple that amount to the patients or charge to their own discretion.
Okay, there you go, triple to the patient or your own discretion. Okay?
So pretty much for about $3,000, a patient can get a full mouth restoration, upper and lower.
Now, what's the durability here? We were talking 3 to 5 years, depending on the care of it.
We've had patients exactly who've been wearing it for about 3, 4, 5 years now. It's very important to educate the patient with the proper path of insertion. Since it works like a partial denture, we survey every single case prior to doing the wax up to allow for that clear path of insertion. Therefore, if the patient is educated to do left or right before going anterior, that's very important so they don't wedge the appliance, take very good care of it, and to carry it in a carrying case that we provide them with a nice mirror and a powder and the gel for taking care of the appliance as well.
Fantastic. So and these people have been really good to deal with as well. So how do we learn more about this? Do you have a website? We have a website,
snaponsmile.com. There's also a phone number that you can call, contact us, also located on the website. And you can see before and after photos as well. There's also webinars that you can attend to.
Oh, okay.
Lectured by our inventor, Dr. Mark Leichtang, who practices in New York City, Manhattan. And there's just so many before and after photos that you can see on his presentation as well.
Okay. Well, now, okay, so we've talked all about this. Do you have an example local, right nearby here?
Yeah, I understand many doctors are skeptical what it's going to look like, what's the emergence profile going to be. So,
can you speak with it? I mean,
if you can speak with it without whistling, and if you can whistle and stuff like that. So I always like to end my conversation and arguments with doing something like this. There's your Snap-on Smile.
All right.
As you can see, I have some tetracycling on my teeth. I can't afford veneers right now. I want to have something in the meantime, see what I might look like with my veneers. And it just snaps into place with no problem.
There it is. There you go. Snap-on Smile.
So we have a concept with holes, when Snap-on Smile can be designed with holes, in which case we would open the holes right there, maintain that same cusp-to-fossa relationship. So throughout the whole arch, you would have those holes opened.
This is the wax up.
This is the wax up that we were doing for that. Or if you like your occlusal surface fully covered, you would have this kind of design with full occlusal surface covered going throughout the whole arch in case you're trying to increase the patient's vertical dimension if the patient is overclosed or similar situation. For a flipper, a typical flipper would have that palatal coverage with the metal clasp showing there, not very aesthetically pleasing. Whereas with Snap-on Smile, there is no palatal coverage, their speech is not affected, aesthetically they're not compromised since we can match any shade and we wax up to get perfect aesthetics, and we open occlusal holes because in this particular case the patient will like his vertical where it is. Great for closing diastemas. If you see the diastema you see right here, you can just close that, cosmetically enhance the patient. It's great for patients who are already wearing partial dentures without that major metal, chrome-based metal major connector going along the palate. With those metal clasps showing here and there, you get 4 times the retention since you're engaging 4 different undercuts, and it just snaps into place and the patient is cosmetically enhanced and without that major connector. Your major connector with Snap-on Smile is the material itself going alongside the lingual surface on the gingival third, right there.